Well, with these reports of foreign nationals being turned away or being refused entry by certain groups from our hospitals, our resident futurist Graeme Codrington is looking at how the future of healthcare may look and whether healthcare and maybe even surgery could be done remotely. Graeme Codrington's a futurist at Tomorrow Today Global. Graeme, good evening to you. Thanks so much for your time. I mean, we've seen the world in so many ways starting to work remotely over the last 3 years or so. Are we seeing that in healthcare too? How big's the change been?
Yes, Stephen, I think that there's a huge possibility of this happening. There's quite a lot of people who can't work remotely, and you would think that certain members of the healthcare profession, the sort of the hands-on nurses and the emergency rooms, they need to be where they are. But there are parts, and I think surgery is definitely one of those, where we can see, and recent reports and results of some experiments are showing positive signs that, for example, in surgery, a doctor might be able to use virtual reality. They already use very fine tools to assist them with fine surgery, so maybe surgery on the eye or the ear or keyhole surgery. And using these tools, and I've got myself one of those virtual reality headsets here. If you put that on, similar to wearing, I suppose, what a doctor might wear with a microscope to see very finely onto a patient. As long as you don't have load shedding and buffering on your internet, you really can imagine very easily that the surgeon doesn't have to be in the same room as the patient. As long as they can see the patient, access that patient via these robotic and probably artificially intelligent assistive tools, you can imagine that a surgeon might be on the other side of the hospital, or maybe working from home, or even the other side of the world. So I think that we definitely can imagine some parts of the medical profession being able to be done remotely without actually being with the medical person and the patient being in the same room at the same time.
In a way, I mean, it may sound a little bit less glamorous, but what we're probably seeing is specialists sending really high-resolution WhatsApp photographs to each other of, I don't know, marks on someone's skin or the results of a particular process or procedure to determine if something's malignant. It's the way that knowledge moves around the world, information moves around the world. You can easily imagine WhatsApp groups of specialists all around the world discussing, the picture of a patient, the picture of an element of a patient, and making a decision. You get a much more informed decision.
And Stephen, I think that's something that we can do as well. Like most South Africans of my age, I was a bit of a sun worshipper as a teenager, and now I have to go every year to the dermatologist just to make sure that I get my body checked for moles and so on. And recently the doctor started to take photographs so that next year he's not relying on his memory or his scrawled notes, but can actually compare last year's and the previous year's photographs. And so my question was to the dermatologist last time I went, why do I have to be here? Why can't I just take the photographs and send it to you? You have a look at it, and then if there's something worth prodding, then I'll come in. So I agree with you. I think internally in the medical field and us to the medical profession, we need to be open to changing how we engage with them and using technology to be able to do it remotely and then access skills that maybe are not within sort of driving or walking distance of your home.
There's also an element of cost here. So, I mean, when people first started doing surgery on people's eyes, in other words, to try and remove corneas, to try and improve people's vision, it was considered amazing at the time, quite expensive. Now, there are hospitals that literally do this almost on a sort of production line. They do hundreds of patients in a day. It's become commonplace. Technology allows you to improve people's lives dramatically at a lot less cost. It removes all of the barriers to that procedure.
And, Stephen, that's hugely important for us in South Africa, because when you begin to think of new and modern technologies like we've just been talking about, you might immediately think that it becomes too expensive for a developing nation like ours. Except a lot of these revolutions and experiments are coming out of developing countries. India and Iran in particular are worth looking at, that both now actually have surgical tourism, where they have found ways to do eye surgery, to do a number of these days, fairly routine operations at a fraction of the cost of what it might cost you in a first world country. Not with any less effectiveness and not with any concern about the safety or the quality, but just realizing that using technology, we are able to get efficiencies and benefits of cost. And I think that that's something that we obviously want to see in South Africa, and I think are seeing in a number of places, but hopefully we'll see more in the future.
Graeme Codrington, thank you very much indeed from today, tomorrow Global. Do appreciate the time.